Hello, 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 YouTube world. It's Miss Patty with 4YourCNA, and we are here for our twice a month live CNA practice test game show. I'm so glad you guys were able to join us today. So when you come in, give me a hello in the chat. Let me know that you're here. We'll get started in just a few minutes. Have some time for everybody to get in and get settled. So for those of you that don't know how this works, so those of you that are new, we are going to present 15 practice test questions that are very similar to what you're going to see on the state exam. Today's topic is going to be providing specialized care for residents with changes in health. So we're going to go over some questions that you might see from this category. These are not the test questions. Nobody can give you those because of test security. But these are questions that are similar to what you would see in scope and content and presentation. So kind of how those questions might be written on the state exam. So I'm going to have a question for answer choices in the chat. You're going to type in the answer choice you want to select, 1, 2, 3, or 4, and hit the send button. Don't write anything else, just the numbers of the choice that you want to make. Now, the program that I'm using will only accept your first answer. So if you change it, it's not going to award you points. The quickest person to get the right answer gets the most points. And my program computes all these points and keeps track of it on a leaderboard. And at the end, we're going to award prizes. So first place is the card game. This is a really fun way to get people interested in CNA. And it's also a great way for you to practice for the state exam, but it can also be played by people that have no medical knowledge at all. So it's just a really fun around the kitchen table game. So that'll be first place. Second place is our 4YourCNA badge holder, and you can't buy these. The only way to get it is to win it. And then third place is going to be some motivational items, keychains, and bracelets and things like that. Now, I do want to say that while anybody is eligible to participate, anybody can play the game, we only ship prizes to people in the U.S. I'm just not set up for international shipping. So, unfortunately, if you win and you're in spot 1, 2, or 3, and you're not in the United States, I'm not going to be able to send you your prize, and I'm super sorry about that. And I'm not allowing people to transfer their prizes anymore because that just got way too confusing for me to keep track of. I got so much going on, guys. So that's how the game is played. So if you've got any questions, go ahead and type them in the chat. We're going to get started here in just a few minutes. Let's see who's here. Good morning, Anna. Good morning, Micheline. Hi, Diania. Anna Rawl, hello, welcome back. Curtis, Jenny, Yasmin, good evening. Antoinette says, hi, my name is Antoinette Hopkins. This is my first time on your live, and I love what you're doing. Keep up the good work. Oh, thank you so much. Oh, you guys are awesome. Hello, Salith. Salith is one of my current students getting ready to graduate tomorrow, so hey, great shout out to this class. Yasmin is from the UAE. Antoinette's from Bradenton. Oh, it's right down the road. Absolutely. Curtis should get mine soon. Esther, hello. Hello, Mary. Chiefs has been on my classroom live stream a lot. Good morning, Tamika. Hi, Marie. Joe Bengals, we've seen you too. And, Chiefs is Vanessa. Okay. Hi, Vanessa. Kanisha. Curtis, is this for California? Yes, these questions are good all over because all states follow the NNAAP, which is the specified test plan. Good morning, Helen. It's DDM, Micheline. From Okeechobee. Hello, Davia from Okeechobee. And I'm doing the CNA and passing things to your videos. Oh, that's wonderful, Vanessa. Congratulations. All right, and Mary and Georgia, so we've got quite a few on. Are you guys ready to play? I'm ready. If you're ready, we're going to go ahead and jump in. Give me just a second to get this started. And, all right, so let's see where we're at. Here we go. Micheline says, I passed my skills test. Now I'm waiting for the written test. Oh, how exciting. This is going to help you a lot. Okay, so we're almost ready to get started. Limber up those fingers. We got about 10 seconds. Are you ready? Here we go. Question number 1. Which of the following is a key aspect of caring for a resident with limited mobility? 1, encouraging long walks. 2, ensuring the call bell is within reach. 3, let me start over. 1, encouraging long walks. 2, providing a firm mattress. 3, ensuring the call bell is within reach. And 4, restricting fluid intake. So which of the following is a key aspect of caring for a resident with limited mobility? Encouraging long walks, providing a firm mattress, ensuring the call bell is within reach, or restricting fluid intake? Go ahead and lock in your final answers. You've got about 10 seconds left. About 5 seconds left. This was an easy one. I started you guys off easy today. Yeah, absolutely. You guys all got this right. Ensuring the call bell is within reach. And that's super important because if somebody has limited mobility, they're not going to be able to take care of their own needs. If somebody has limited mobility, they're not going to be able to walk to the bathroom by themselves or get themselves a drink or a sweater if it's cold in there. So if they do try to do those things on their own, because of their limitations, they may be a fall risk. So we want to try to prevent injury, and the way that we do that is making sure that they always have access to be able to call for help. And that way they're not trying to do these things on their own with the potential of getting injured. Encouraging long walks, that's going to be on the care plan. So Anna came in first on that one, followed by Anna, Tamika, and Salith. Good job. Very good. Okay, we're going to go on to question number 2. Guys ready? How does impaired vision most commonly affect a resident's safety? 1, causes confusion. 2, increases fall risk. 3, leads to dehydration. Or 4, reduces appetite. So how does impaired vision most commonly affect a resident's safety? 1, causes confusion. 2, increases the fall risk. 3, leads to dehydration. Or 4, reduces appetite. Go ahead and lock in your final answer. You have about 15 seconds left. So this is finding out whether you understand how common ailments are going to affect our ability to provide patient care. That's what this section is all about. And the right answer is number 2. You guys got this one right. It increases the fall risk because if you're not able to see all of the obstacles in your way, you're more likely to be able to trip over them. So if you can't see how a rug is elevated off the floor, you can't adjust your gait. If you can't see furniture that's in the way, you can't maneuver around it. If you can't see small objects on the floor, they can become a tripping hazard. So when we have an impaired vision or limited vision, it can cause us to have an increased risk of falls. Now, limited vision doesn't cause confusion. It could lead to dehydration, though, if the patient cannot reach or does not know where their water is, but that's not the best answer. So Anna came in first on that one, followed by Anaral and Tamika. Good job, guys. Good job. Moving on to question number 3. What is a key consideration when caring for a resident with anxiety? 1, providing a noisy environment. 2, encouraging social isolation. 3, maintaining a calm atmosphere. Or 4, restricting hydration. So what is a key consideration when caring for a resident with anxiety? 1, providing a noisy environment. 2, encouraging social isolation. 3, maintaining a calm atmosphere. or 4, restricting hydration. And these are the types of questions that you might see on the state exam. Very similar. So getting used to the way the questions are presented and how the answer choices are worded is going to be a really big part of preparing for that state exam. About 5 seconds left. Very good. Yeah, maintaining a calm atmosphere, absolutely. That's going to help decrease anxiety. But here's something that a lot of CNAs don't think about because we get so wrapped up in our day-to-day routines. We have tasks that we're going to do, we have patients we have to see, and we kind of get involved in our own routine. Your patients are probably going to have anxiety. They're anxious over what their health processes are doing. They're anxious over whether what you're going to do hurts. They're anxious over, am I going to be able to go home? How am I going to afford this? They're anxious over the fact that their family isn't there to visit with them. A lot of our patients have anxiety. So for us, keeping a calm atmosphere is super important at all times. Anna Rawl came in first on that one, followed by Anna and Salith. Very good. Yes, the questions, Joe Bengals, are going to be very similar to the state exam. So question number 4, how should a caregiver approach a resident showing signs of depression? 1, ignore the symptoms. 2, isolate the resident. 3, force them to participate in group activities. Or 4, encourage activity and social interaction. So how should a caregiver approach a resident showing signs of depression? 1, ignore the symptoms. 2, isolate the resident. 3, force them to participate in group activities. Or 4, encourage activity and social interaction. Go ahead and lock in your final question. Chiefs, you need to know that you only need one number. Don't type in lots of numbers, just one, because the machine isn't reading that string of numbers. It's only looking for one. So our answer here is number 4, encourage activity and social interaction. Yeah, now a lot of CNAs just ignore the symptoms, and that's not effective for our patient because that can affect their energy level, their digestion, their interaction with others, their appetite. It can affect everything. Depression affects your entire body. So don't ignore the symptoms and don't isolate the resident either. Forcing them, if you ever see an answer that says force, it's never the right answer. But yes, encouraging them and getting them involved in social activities that are interesting to them can help with managing depressions, signs of depression. All right, Anna Rawl came in first, followed by Anna and Salith. Good job, guys. Very good job. All right, no problem, no problem. I just wanted to let you know that it's not reading your answers. All right, question number 5. What is an appropriate action when a resident exhibits confusion? 1, use clear and simple instructions. 2, increase their medication dosage. 3, leave them alone. Or 4, restrict food intake. So what is an appropriate action when a resident exhibits confusion? 1, use clear and simple instructions. 2, increase medication dosage. 3, leave them alone. Or 4, restrict food intake. So you want to lock in your final answers. You have about 20 seconds left. And be careful here because there's one answer here that is designed to trick you. We'll talk about that in a minute. So the final answer here is number 1. Yeah, you guys got this one right. We're going to use clear and simple instructions, and we want to make sure that we're not overloading them with information, especially if they have confusion. So one step at a time. Now, increasing medication dosage is not appropriate. You're going to want to know your scope of practice for the state exam. And some of you probably have your certificate to pass medications. But even still, that's not in the scope of practice of a medication aid. We don't increase dosages. Never leave them alone. That's not the right answer. And we don't restrict food intake either. All right, looks like Anna Raw came in first, followed by Anna and Salith. Okay, here we go. Question number 6. You're caring for a patient who often acts angry and voices frequent complaints. The patient may be experiencing 1, irrational phobias, 2, the anger stage of grief, 3, an unpleasant personality, or 4, uncontrolled dementia. You're caring for a patient who often acts angry and voices frequent complaints. This patient may be experiencing 1, irrational phobias, 2, the anger stage of grief, 3, an unpleasant personality, or 4, uncontrolled dementia. So go ahead and lock in your final answers. You have about 10 seconds left. Oh, you got a couple of different answers on this one. All right. So patients that often act angry and voice frequent complaints may be experiencing the anger stage of grief. And we have to think about grief for a second, right? We talked about this in class yesterday for those of you that joined. But a lot of our patients are experiencing grief. They're experiencing the grief of losing their health, losing their independence. And in some cases, they have lost their home and their pets and their belongings to be able to afford the place that they're in. So grief is a very common reaction in our patients, and we have to understand that this is often manifested in anger. So be patient with your patients. They're experiencing a loss. Looks like Anna came in first on that one, followed by Salith and Joe Bengals. Good job. Okay, moving on to question number 7. Which of the following is performed by the CNA regarding post-mortem care? 1, bathe and dress the body. 2, remove medical devices. 3, notify the family. Or 4, document the time of death. So which of the following is performed by the CNA regarding post-mortem care? 1, bathe and dress the body. 2, remove medical devices. 3, notify the family. Or 4, document the time of death. Go ahead and lock in your final answers. You've got about 20 seconds left. 20 seconds left. So I've got to tell you a story after this quiz is over. I've got to tell you a story and why the types of questions you use matter to practice for the test. All right, so the right answer here is number 1, bathe and dress the body, and that's correct. CNAs do not remove medical devices, we do not notify the family, and we do not document the time of death. Those are not within the scope of practice of the CNA. So it's very, very important that we understand our role within the medical system, because when we step outside of our role or our scope of practice, when we step outside of that, we now assume liability for our actions and can open us up for a lawsuit. So CNAs have to understand their scope of practice. Now, you can be trained to do other tasks, but as a general CNA without additional training, bathing and dressing the body is the only thing we can do. So Anna came in first, followed by Salith and Micheline. Good job. Okay, we're about halfway done now. So question number 8. How can caregivers prevent pressure ulcers in bedridden residents? 1, increase caloric intake. 2, restrict movement. 3, provide more fluids. Or 4, reposition the resident regularly. So how can caregivers prevent pressure ulcers in bedridden residents? 1, increase caloric intake. 2, restrict movement. 3, provide more fluids. Or 4, regularly reposition the patient. So go ahead and lock in your final answer. We've got about 15 seconds left. All right, yeah, I see a couple different answers on here. You guys are a little split on this one. And 5 seconds left. Go ahead and get those answers in. And our correct answer is number 4. Regularly reposition the patient. Absolutely. That is the number one way to prevent pressure sores or bed sores, or decubitus ulcers is what they're called. We don't increase caloric intake, restrict movement, or provide more fluids unless the care plan tells us to. But knowing that immobile patients need to be repositioned every 2 hours, that is within our scope of practice. So we have to know what's going to be what we call general orders or accepted tasks, and what has to be reflected on the care plan. And that's what this question is asking us. Anna came in first on that one, followed by Anarol, Salith, and Micheline. Question number 9. What is an essential aspect of caring for residents with respiratory impairments? 1, providing frequent rest periods. 2, increasing physical activity. 3, limiting fluid intake. Or 4, reducing caloric intake. So what is an essential aspect of caring for residents with respiratory impairments? 1, providing frequent rest periods. 2, increasing physical activity. 3, limiting fluid intake. Or 4, reducing caloric intake. So this one's a little more challenging. So you've got about 10 seconds left. Go ahead and get your answers in. Good job. All right, the right answer here is number 1, providing frequent rest periods. Because when you have respiratory ailments, it's going to affect how much oxygen your body is taking in and distributing out to the cells and the muscles, which means that you're going to tire a lot easier. You're not going to have as much stamina. So providing frequent rest periods is very important so that we don't get that increase in respiratory rate and that's going to affect the gas exchange. Increasing physical activity is not a good idea when a patient has a respiratory impairment unless physical therapy is overseeing that. We actually don't want to limit fluid intake. In a lot of cases, we are going to increase fluids to get those secretions up, but not always. So that requires the care plan. So It's DDM came in first, followed by Helen and Adriana. Good job. That one was a little harder, wasn't it? Yeah. So question number 10. Almost done, guys. What is a common challenge in caring for residents with severe arthritis? 1, reduced mobility. 2, increased anger, frustration, and distrust. 3, decreased nutritional needs. Or 4, reduced stamina due to shortness of breath. So what is a common challenge in caring for residents with severe arthritis? 1, reduced mobility. 2, increased anger, frustration, and distrust. 3, decreased nutritional needs. Or 4, reduced stamina due to shortness of breath. So what is a common challenge? About 5 seconds left. This requires that you know what arthritis is. It's not going to ask you what is arthritis, but we need to know that arthritis is an inflammation of the joints which causes reduced mobility. So this is how they're going to use medical terminology on the test. It's going to be in a scenario format, and it's going to assume that you know what that term means in order to get the right answer. So number 2 is actually anxiety, not arthritis. And arthritis does not have decreased nutritional needs. And it doesn't really affect our ability to work with the patient because of shortness of breath. So reduced mobility is the right answer here. So let's see how we did. Looks like Anna Raw came in first, followed by Chiefs, and then Anna. Good job, guys. Very good. Moving on to question number 11. 5 questions left. Question number 11. Why is it important to ensure proper hydration in residents with physical impairments? 1, to increase caloric intake. 2, to reduce social interaction. 3, to enhance cognitive function. Or 4, to prevent urinary tract infections. So why is it important to ensure proper hydration in residents with physical impairments? 1, to increase caloric intake. 2, to reduce social interaction. 3, to enhance cognitive function. Or 4, to prevent urinary tract infections. Got about 10 seconds left. Oh, I thought this was going to be harder for you guys. This turned out to be an easy question. Look how smart you guys are. I thought this one was going to be harder. Yeah, absolutely. You guys got this one right, to prevent urinary tract infections, and let me explain why. So when you have somebody with physical impairments, it's going to be harder for them to go to the bathroom, which means they need your help in most cases. That's a lot of time and a lot of effort. So a lot of CNAs, unfortunately, will start restricting fluids just so that they don't have to take the patient to the bathroom as often. Now, this doesn't benefit the patient in any way, and holding that urine and having decreased fluid intake sets them up for the potential of urinary tract infections. So when you're out there working, remember this. It's not about you. It's always about the patient. So never take steps that benefit you and not the patient. So it looks like Anna came in first, followed by Anaral and Salith. You guys did really good on that one. I'm super proud of you. Great job. Great job. All right, moving on to question number 12. What is a key consideration when caring for a patient experiencing shortness of breath? 1, encouraging deep, rapid breaths. 2, placing the patient in a flat position. 3, position the patient upright or leaning forward. Or 4, increasing the patient's physical activity. So what is a key consideration when caring for a patient experiencing shortness of breath? 1, encouraging deep, rapid breaths. 2, placing the patient in a flat position. 3, position the patient upright or leaning forward. 4, increasing the patient's physical activity. So you've got about 10 seconds left. Go ahead and lock in your answer. The correct answer here is number 3. Yeah, position the resident upright or leaning forward. And this helps with shortness of breath. Even the simple act of like leaning forward like this helps reduce the restriction in the lungs and can help them open up a little bit more fully. What makes number 1 wrong, and some of you chose number 1, and sometimes that happens. We see a answer and we pick it without looking at all the other answer choices. What makes number 1 wrong is rapid. We don't want to encourage deep, rapid breaths. It's deep, slow breaths. So that's what makes number 1 wrong. And they're going to have questions on the test like that, where even the order of the answer choices are put in a specific way to trip you up. So read all the answer choices thoroughly. Anaral came in first on that one, followed by Mary and then Micheline. All right, moving on to question number 13. When caring for a diabetic patient, the CNA should be prepared to 1, inspect all skin surfaces daily. 2, administer medications quickly. 3, restrict mobility after meals. Or 4, perform all ADLs. So when caring for a diabetic patient, the CNA should be prepared to 1, inspect all skin surfaces daily. 2, administer medications quickly. 3, restrict mobility after meals. And 4, perform all ADLs. Go ahead and lock in your final answer. You guys are making me super proud. I am so proud of all of you. Great job. This question was designed to trip you up. And you guys were listening to my lecture. Congratulations. I'm so proud. Absolutely. We're going to inspect all those skin surfaces daily. And that is a key component to providing diabetic care. Administering medications, that's not something CNAs do. We don't want to restrict mobility after meals. In fact, a little walk after a meal is good for digestion, and it actually helps with the absorption of nutrients and the production of insulin. And we don't perform all ADLs for all patients. We just help them with whatever they need help with. So that's going to be dependent on our care plan. But we do need to know that when our patient is diabetic, they're much more likely to have an injury that they're not aware of. So inspecting all skin surfaces is super important. So Anna came in first, followed by Helen and Anarol. Oh, thank you guys. I appreciate that. Thank you. But I'm super proud of you guys. You have no idea. I'm super proud. Question number 14. The care plan states that the patient should be provided thickened liquids. This means the patient has 1, difficulty swallowing, 2, unreasonable tastes or preferences, 3, diabetes, or 4, the ability to feed themselves. So the care plan states that the patient should be provided thickened liquids. This means the patient has 1, difficulty swallowing, 2, unreasonable tastes or preferences, 3, diabetes, or 4, the ability to feed themselves. Oh, look at you guys go. Oh, I'm so proud. You guys are going to make amazing caregivers. Thank you guys so much for including me in your journey. You have no idea what this does for me. I'm super proud. All right, the right answer here is yes, difficulty swallowing. Absolutely. Yeah, if somebody has difficulty swallowing, those thin liquids can be quite a challenge because the swallowing reflex actually closes off the trachea or windpipe and opens up the esophagus, which leads to the stomach. That's what the swallowing process does. It closes one tube and opens another. If we have difficulty swallowing, that means that trachea doesn't get all the way closed, and liquids, specifically thin liquids, can drip into that breathing tube or that trachea and down into the bronchioles, which can lead to aspiration or breathing in food or fluid. So we thicken the liquids to make it more difficult for that to just slide down, and then things go where they're supposed to go. Anna came in first, followed by Anarol and Latisse. Good job. Hi, Willie. Thank you for joining. I'm super happy that you were able to make it. We do this twice a month. Last question here. The patient receives nourishment through a gastrostomy tube. The CNA is permitted to 1, flush the tube before feeding, 2, verify placement of tube before feeding, 3, administer the tube feeding, or 4, position the patient for feeding. So a patient receives nourishment through a gastrostomy tube, also known as a G tube. The CNA is permitted to 1, flush the tube before feeding, 2, verify placement of the tube before feeding, 3, administer the tube feeding, or 4, position the patient for feeding. So what are we allowed to do as a CNA for patients with G tubes or gastrostomy tubes? So here's another one of those big words they put in a question. Yeah, all we can do here is position the patient for feeding. We are not ever allowed to flush the tube, verify the placement, or administer the tube feeding. That is limited to nurses. So very, very important that we understand our role here, because the risk of aspiration is super high with tube feedings. There's a lot that can go wrong. And because there are things that could go wrong and affect the patient, we need somebody able to recognize and act very quickly. So that would have to be a nurse. So yeah, positioning the resident for feeding, that is something that we can do. And the patient needs to be upright, by the way. Good job. Anna came in first on that one, followed by Anarol and Salith. So good job. You guys did fantastic today. Fantastic. I'm so proud of all of you. Let's see how we did on the final scores. Anarol came in first, followed by Anna and Salith. So great job to all of you. Congratulations. I'm super proud. And what I need you to do, let me get this here. What I need you to do to claim your prizes. So my first, second, and third place winners, I want you to send an email to 4YourCNA@gmail.com. Let me know your screen name, your real name, your mailing address, and what place you came in. Now, Salith, I know you're in my class, so tomorrow when you come in for graduation, I can give you your prizes then, or your prize then. So this is going to be for Anarol 127, Anna, and Salith. Send me an email to 4YourCNA@gmail.com with your screen name, your real name, your mailing address, and what place you came in, and we'll get your prizes out to you this week. I'm super proud of all of you. Thank you so much for joining us, and I hope you found this helpful. If you did, give us a thumbs up on YouTube. That way other people know that this was helpful to you. But let me tell you a little story, okay? So I'm gonna shorten this. I'm not going to keep you long, but I do want to highlight this because I think it's important that you know this. So if you've been paying attention to the news at all, you know that AI is becoming really big. People are using AI in all kinds of industries, and it's really helping with content creation and all kinds of stuff, right? So there's a huge push for content creators like me to use AI in creating content and automating stuff and all this. So I was running a little late on my timing. So I taught all day yesterday. I came home, and then I am actually in a upper level college course as well. So I had my course last night. So late last night, I had to write questions for today. And I thought, well, you know, this AI thing, right? So I went on to AI and I asked AI to create 15 test questions for CNAs on this topic. Out of those 15 questions, now I'm a professional test writer. This is what I do. But out of those 15 questions, there were only 2 that I could use that were appropriate for your scope of practice and had answer choices that made sense. So a lot of them were asking for answer choices that would have been appropriate for nursing, not CNAs. So AI doesn't really understand the distinction between nursing education, and CNA education. And we can't expect it to, because a lot of nurses don't even know the difference, right? But I do, because that's what I do. So I looked at these questions and I can only use 2. Now, you had 2 of them in there. The rest of them had to be written by me. And that's because I used maybe some of the ideas that it generated, but I wrote the questions and the answer choices because I know how to prepare you for the test. Now, why do I bring that up? Well, first of all, AI is not a shortcut for me. I actually have to do the work. But the real problem here is that there are a lot of, and you're going to see a lot more, practice tests out there for you to access to get ready for the test. And, you know, if you type in CNA practice tests, there's a whole bunch of them. And that's great. And you need those opportunities. And I'm not saying to not take advantage of them, but understand that with AI, it's making it easier for people with no medical knowledge to create websites with questions that may not really be appropriate. Now, those websites only exist for one reason, and it's not to help you. It's to make the people money because they get ad revenue for serving you ads. So when you go onto a practice test website and the questions make you doubt yourself, you read the question, you're like, oh my gosh, I don't know that answer. That causes you to take more tests, to prepare more, because you think that you don't have the knowledge you need to take the test. So it causes a lot of confusion and doubt in you, which is a bad thing because you need to take the test. But the real thing is, it doesn't really indicate whether you're ready for the test because the people that wrote the questions don't know the test. It's an AI generator somewhere that doesn't really know what's appropriate. So the only thing that I want to say about this is you don't stop using practice tests. But if the question doesn't really fit into something that you know, don't automatically think it's a knowledge gap in you. It may be a knowledge gap in the AI that wrote the question. Does that make sense? So when you're doing questions on any website or YouTube video or whatever, make sure that the people that actually wrote those questions really knew what they were doing and actually wrote them and didn't depend on an AI prompt that doesn't really know your scope of practice. Okay, so that's my tip for today. Just be careful and don't automatically think it's a knowledge deficit in you if you get the answer wrong. So that's why I like doing this, because I give you immediate feedback. I tell you why the right answer is right and why the wrong answers are wrong. So you can learn alongside as you're doing this. So I hope that helps you. Let's see here. Thanks, Miss Patty. You're such a big help. Your CNA skills book and online classes. I miss the CPR. Where can I watch? Oh, I'm so sorry. That is one thing that I don't broadcast is the CPR. I'm not allowed. American Heart won't let me do that. So I don't broadcast the CPR training, and I do apologize for that. But I do encourage you to go get CPR certified. Most of your employers are going to require it. So let's see here. Boxing's Theologian. Oh, what a name. That's cool. This is good. Thanks. Awesome. All right, guys. So I'm not going to keep you any further. Go forth and spread cheer. It's almost the 4th of July, so fireworks commence. I hope you guys all have a very safe and happy 4th of July. Thank you so much for hanging out with me today. I really enjoy the time I get to spend with you guys. Tomorrow's graduation, so we're going to congratulate all of our classroom graduates. I'm super proud. Thank you so much for joining me, and we will see you in 2 weeks for another CNA Live game show. Until next time, happy caregiving and happy 4th. Bye.